Starting. Hi, everybody. How's it going? Let me just adjust this just a second. Uh-oh. Let's see if we can do this just a sec, guys. Okay, can everybody see me? Hold on one second. There we go, way better. All right, can everybody see me? Where's everybody from? There we go. Okay, perfect. Hi, it's me. I got my hair cut. Same person, different hairstyle. Where's everybody from? Come on, people. I see 17 of you are watching. Okay, guys, so I guess I'll get going here. How's everybody doing today? So I'm Adrienne Coombs. I've done 3 live videos now, getting better and better at them. But so I'm an acupuncturist and Chinese herbalist and a certified sports medicine practitioner in Kelowna, BC, Canada. And today we're talking about cupping. I was gonna talk about gua sha as well, but the cupping is a big topic. I'm gonna be doing a demo as well. And the gua sha, again, like the more I was preparing for the talk, the more information I got, and I don't want to rush anything. So cupping today, gua sha next week, I think. And so if you guys have any questions throughout the video, please feel free to ask. I'll do my best to answer them throughout the videos, okay? Okay, so cupping. A lot of you have heard about it before. Some of you have tried it, I'm sure. It's something that I incorporate into my practice every day with every treatment, unless it's specifically asked that I don't do cupping, which is very rare. So to start off, I'll talk about the different suction cups that do exist. So primarily the very first cups that existed thousands of years ago, the Egyptians used hollowed out horns, and they weren't really used for the myofascial benefits that they are today, but they were used more for sucking out boiled, carbuncles, and infectious diseases like that, more dermatological issues. But now obviously things have changed quite significantly and we're not using those anymore. So glass, plastic, silicone, and bamboo are the ones that are more or less used today. Hi everybody, yay, people finally commenting. Where are you guys from? Come on. Okay, I'm gonna keep going then. So my favorite are the glass. So I've got some glass cups here. So this is a pretty large one that I would use for like a quad, a hamstring, a glute, maybe for a low back as well. This one's a little bit smaller, you see, so these are more for up and down your back, shoulders. Hello from Dublin, that's a long way away, great. So there's this size, and then I've got even a smaller size. So this one's really good for like neck and upper traps. Dallas, Texas, Maryland, yay. Hi guys, thanks for tuning in. And then I've got super small ones, so these are good for like bottom of the feet, hands, really up at the base of your neck. So lots of sizes to use from. So I love the glass cups the best. They hold suction better, they slide better, they're more durable, and the most important thing is that they're the easiest to clean because you're using cups between patients and oh, hello from Malaysia, that's a long way away. Great guys. So make sure that you ask any questions throughout, and I'll do my best to answer them. So where was I? So yeah, you'd have to sanitize them, of course, because you're using the same cups for several different people. So the way that these work is I use a cotton ball soaked in 99% alcohol. Just gives a super big flame, and so I light this on fire. We do use fire with these cups. Stick it in the cup, take it out, put the cup on your skin. I'll be doing a demo later to show all of this. But I find that with the flame, you can really control the amount of suction quite easily. So the flame is going to eat up the oxygen inside the cup and create a vacuum. So as long as you're quick enough to get the flame out of the cup onto the skin, a suction is created. So the bigger the flame, the longer you leave the flame into the cup, and the faster you get it onto the skin, the stronger the suction is going to be. And then to release the suction, again, I'll show this in the demo, you just need to just make a little pocket between the skin and the edge edge of the cup. But yeah, I find that these are the best and the ones that I only use in clinic. Other than that, there's plastic ones that I see a lot of people using. So they come with a little pump, and you just put the plastic cup on, you can pump it up. So I don't use these because, I mean, I'm super biased for the glass cups, but I find that they're not as easy to clean, because again, you do need to like disinfect them for sure. And there are disposable ones that you can use, but those are pretty wasteful. And I do really like playing with fire. I think it's awesome. I haven't burnt any clinics down yet. Hopefully that never happens. And then lastly, silicone cups. Sorry, not lastly, but these are also ones that you can use. So these are good for using on yourself. Again, they are difficult to sanitize, so I don't use them on my patients, but they are really good for. Ooh. Oh my god, sorry, casualty there. But they're really good for getting onto like bony prominences like an elbow or a knee, because they can mold to kind of the surroundings. Really good to use in yourself. I have some patients that have these and they use them on their legs in the shower. Really helps with circulation. And then lastly, there are, oh, hold on a second. Where am I? Okay, so sorry, lastly, there's bamboo cups. So bamboo cups are mostly used in China. They were one of the original types of cups to be used. So the great thing about bamboo cups is that the cups can be soaked in Chinese herbs prior to having them placed on your body. So that can be beneficial for so many different things, because you can put a formula into a vat, you can create a herbal formula tea, soak the cups in there, and then use it. So what that does is, say there's somebody with a lot of dampness, a lot of swelling, you can use a damp draining herbal formula, soak the cups in there, let them dry, and then use the cups on your body on where the swelling is. And so not only are you getting the benefits of the cupping itself, but the herbal formula is leaching into your skin and having that powerful downward draining effect on the swelling. So super amazing that they can do that. I personally don't do this. I mean, I have bamboo cups at home, but I just find that it's a pretty big effort. And again, they're super hard to clean. So kind of to the next point, what does cupping do? So when you have a suction, it's lifting and separating all the tissues beneath the cup. So what that's doing is creating fresh space for new blood to come in, and it's helping the area to improve blood and lymph circulation in that area. It helps to decrease inflammation, and it gives the muscles a really good stretch. So there's also it also has benefits to really calm the nervous system. So for this case, people have used it for high blood pressure, anxiety, all that kind of stuff. So there's tons and tons of uses. But when you do have an inflamed muscle or traumatized tissue, inflammatory byproducts can get lodged within the tissue, which can impede proper regeneration and healing. So with the suction, it'll help to pull those byproducts closer to the surface of the skin, which will then be carried away by the circulatory system. So by doing this, you also get a massive amounts of fresh blood to the tissues, carrying all the nutrients that needed to quicken the healing process in that area. So they do a whole bunch of things. Some like specific things that they're used for. So any sort of pain, so neck pain, back pain, shoulder pain, any sort of trauma where there's injury to tissues, they can be used. Obviously, you don't want to put a suction cup on an open wound. But basically any sort of like internal orthopedic injury, you can definitely use them for. Even for anywhere the cup will really stick. So even for like plantar fasciitis, I use this technique a lot, where I take like the little small cups and throw them on the bottom of your feet for a few minutes. It feels really good, and I find that you can get super beneficial effects with cupping the bottom of your feet. Even trigger finger on your hand, you can help it with. But it's just really good for any sort of stiff muscles, so it helps to really treat the fascia. It helps to treat anxiety, like I said. It's really good for fatigue, because it does really increase that circulation to your organs as well. Good for migraines, arthritis, and even cellulite. Hello from Romania, that's great. I'm glad you guys are tuning in all the way over there. So I'm not a huge aesthetics practitioner. I don't do a lot of like the facial rejuvenation stuff or the cellulite stuff that some practitioners do, but cupping can be really, really beneficial for cellulite. I know this first on because I did have a patient who she was training for Cirque du Soleil tryout. So those who don't know what Cirque du Soleil is, it's like the crazy acrobatics that they do. The shows are in like Vegas and all over the world. Anyway, so she lost her ability to do the splits after an accident. Like her legs were just super, super seized. Like her muscles would not allow any flexibility. So I treated her for about 6 weeks, every kind of like 3 to 5 days or so. Hello from Ecuador. Hi. So every 3 to 5 days or so, and this included tons and tons of cupping on her low back, her hips, her legs, lots of needles as well. And then after the cycle of treatment, not only was she able to like do the splits fully, even like more like hyperextend, but her legs were like absolutely gorgeous. Like the little bit of cellulite she had prior was completely gone, like so soft, so smooth, and I was like totally sold on the fact that cupping can really make a huge difference on cellulite for sure. Again, and that's not where my practice is, but there are some practitioners out there that do this, and it does actually work really, really well. So the marks are the biggest things that people kind of like and dislike. I know some of my patients that really want me to like mark them up as much as I can. So Michael Phelps was covered in cupping marks in the Olympics, all over his neck, all over his back. And I always see some of the Chinese athletes as well in the Olympics, and they're usually covered in cupping marks as well. But he definitely made cupping pretty darn famous. And I had a lot of my patients ask me about cupping at that time. So they're not bruises. Everybody does think that they're bruises, but they're not. It's the byproduct of inflammation that comes to the surface of the skin. So the more inflammation you have, the darker the marks are going to be, and then the longer that they're going to stay around. Okay, we had a question. I had a knee injury, which led me to having cupping therapy. It helped regain my mobility. That's amazing. Yeah, it's awesome. And especially with the knees, getting the cups like all around your knee for sure. Getting all the old stagnant blood out, replacing it with new circulation. That's awesome. I'm glad you had such a great effect. So generally speaking, the cup marks will last like 1 to 3 days or so. I've seen some marks last like weeks. In those cases, the people it's a pretty serious trauma, very unhealthy, super inflamed, kind of inflammation from both the trauma and then just living an unhealthy lifestyle. Even with that, you will see a lot of really, really dark marks if you're treating somebody who doesn't eat properly, doesn't exercise, smokes, all that kind of stuff. So, but the more you get cupping done, the lighter the marks are going to be. So I'll treat somebody for the first time ever, the marks will be like purple, and then 2 weeks later, I'll treat them again, the marks will be like a little bit lighter purple, and then pink, and then eventually, when there's like zero inflammation, the marks are gone within like an hour after treatment. Okay, so the marks are really beneficial also for diagnostic purposes. Bilateral to your spine in Chinese medicine, about 1.5 inches bilateral on either side of your spine, are acupuncture points that represent different organs. So one way we can kind of figure out what's going on the inside is we can put these cups up and down your spine on either side and see what kind of colors pop up. So for example, for example, like your lung point is bilateral to T3. So putting cups there, let them sit for a few minutes, see what colors pop up. So I've seen cases where the lung points are really, really bright red. So in Chinese medicine, that bright red is an indication of heat. So in this case, this patient had a pretty bad chest infection, just like a super acute issue. They had a fever going on. It can also mean like you're about to get sick, all this kind of stuff. I've treated some smokers as well, and I've done this, put the cups on pretty heavy on their lung points, and like the marks that come up are sometimes like dark purple or like even black in some cases. And again, in Chinese medicine, that's a sign of toxic heat in those organs. So smokers, you'll see that. Anybody with like a heavy case of pneumonia, you'll see that. Here we go. Hold on. Let's see what kind of questions we got here. I have plantar fasciitis and try to use them. They won't stay on the bottom. So if you're having issues having the cups stay on the bottom of your foot, I would recommend putting some lotion on. And then, I mean, if you have a partner to try to lie face down, so your partner can put them on the back of your feet with your feet in extension, sorry, the bottom of your foot. So yeah, just try some lotion or some coconut oil to give it a bit more lubrication. Sometimes that can make a big difference. Also, if the cup is too big, it won't stick very well on your foot either. Okay, minus a bruise from massage on Monday. It takes weeks to go back to normal. Well, the bruises are byproducts of inflammation. If they are bruising super heavily every single time, it might be that they're on too tight. If you're finding that every time you're going back to your massage therapist and there's still the color isn't changing, either you're still full of inflammation or the cups are on too tight. You don't want them so tight that you can't move them around. And it can be quite painful if they are on too tight as well. So make sure that you ask her that next time, and get her to note the coloring if the color is even changing a little bit from treatment to treatment. Okay, so when it comes to an old injury, if I place cups around like an old shoulder injury and there's almost zero color, which happens a lot of the time, especially with low back pain, I find this. Sometimes when you leave a cup there, it almost looks white and feels cold. What this means is that there's like literally zero circulation going to that area, which could be because of the injury, or it could be the reason the injury occurred in the first place. So in this case, I take a Lancet, like a diabetic Lancet, one of these little guys. Some people think this is pretty barbaric, but it works so well. And I just poke a whole bunch of little holes around that area, and then I throw the suction cup on, and then what I see is blood coming out of the skin into the cup. Of course, I'm wearing gloves and everything's sanitary, but that blood that's coming out of the skin has to be immediately replaced with fresh blood in the tissues. So that tissue is now getting immediate circulation from the bloodstream, and I've seen like instant amazing results with this. It's actually pretty mind-blowing. So I might have to do that a couple times, and then again sometimes on like really old injuries, when I'll cup an old injured shoulder that happened like 20 years ago, and the cut marks will be like almost black. Again, I'll get the little diabetic Lancet, do a couple holes, put the cups on, and in this case, the blood that comes out is going to be really dark. Like I've seen some like purple colored blood come out of shoulders before. It's really weird. And what I would do is I would just change the cups over and over with lots of suction until some of the bright red blood started to come out again. And again, that's just the old blood coming out, old stagnant blood, which can be lodged in tissues. And again, that could be impeding healing in that area. So you can place cups on the body stationary, or you can apply oil, move them around. There's a whole bunch of different ways to do it. I prefer to do a little bit of both. I find that the moving cups just really gets good circulation through the whole area that you're trying to treat. Is your name actually Adrienne Combs? No way. That's amazing. Hi, nice to meet you. Wow, it's like a couple letters out in each. That's great. That's awesome. Okay, sorry, so where was I? So yeah, I usually do a combination of both. So say I'm treating like low back pain, I'll put cups on one side of the spine stationary, and then on the other side, I'll put some oil on and throw the cup on and move it around, and then switch after I've done. So here we go. Are the treatments with cupping focused mostly on the back U points corresponding with various organs? No, not necessarily. I'm having problems seeing more. Hold on a second. Why can't I see more? Oh, no, it's not working. Just a sec. Oh, hold on. I'm sorry, just a second. No, I can't see the rest of your question. After the treatments with cupping focused mostly on the back U points corresponding with No, they're not focused mostly on the back. You can do cupping anywhere on the body. If I'm not really treating a specific injury, or even if I'm treating something like anxiety or high blood pressure, like we said, cupping can treat, I'll usually just do moving cups up and down the spine, a little bit into the low back and hips, a little bit into the neck and shoulders, but just kind of get the whole entire back. But you can put cups anywhere in the body, anywhere that they'll stick properly. So any more questions? I've got a demo here to show you, but if there's any questions that you wanted me to go over beforehand, just let me know. Hold on. Okay, let me just get my stuff ready. Okay, my beautiful, lovely assistant, Jessie. Died from herniated disc, dislocated neck. Oh, I don't know why I can't see the rest of this. Sorry, guys. Every time that I go to see more, it doesn't let me see more of the question. Can you slide cup over the kidneys? Absolutely you can. And again, you can put cups so your kidney points are bilateral to L2, so on your lower back. You can put cups over the area of your kidneys to see if there's anything going on. Like this one time I was treating a patient who she was just diagnosed with tumors in her kidneys, and the one kidney that had the tumor, the part was like black. It was insane. It was so cool to see. Needle fear. Don't be scared of the needles. They're awesome. Okay, so any more questions before we get going on our demo? Okay, so my lovely assistant Jessie is going to jump on the table here. We're just going to wait a second while she gets all done up. What? No, just stop. Yeah. Okay, so let me just get this set up. I do have my my fellow chiropractor coming to like hold the camera, but in the meantime, we have like a station to put it on. You good like that? Mm-hmm. Hold on. Okay, there we go. Okay, so okay, awesome. Oh shit, I did it again. Oh my god, my phone keeps falling. Okay. Okay, can you guys all see this? Hold on, let me take this out. Sorry guys, there we go, that's better. Okay, so I'm just gonna put a little bit of lotion on her back here. Just put this up a little bit. It'll be better when DJ gets here. Okay, so we're just gonna do some walking cups on her back. So if you can see this, she's had a little bit of cupping already. This is from me from the other day. See the marks here, and then here, and a little bit over here. That was from how many days ago, Jessie? Don't even know, like a couple days ago. Monday. I think it was on Monday. Okay, so. Okay. Okay, so let me sit down for this. I got my hemostat with my cotton ball. I got my cups, and I got a lighter. So again, you gotta be pretty quick with the flame. So I'm gonna get this closer. So there you guys go. And so if I wasn't really treating anything specific, I would be doing these up and down her spine like this. And Jessie, how does that feel?
Great.
Yeah, it usually feels pretty darn good. And you can see how much suction, like the skin, how much the skin comes up with the suction, quite a bit. And you can see a little bit of marks already leaving here a little bit. So yeah, normally I'd put a couple cups on each side, move them up and down. And then if I was doing neck and shoulders, I would just put some lotion here and then really kind of get up into her neck like that. Some people who are super tender, if they have an acute injury, they probably don't like this very much. So in that case, I would just have them stationary. Okay, Jessie, I think we're done. Okay, there we go. So that was my demo. So yeah, if somebody's super, we're good. Hold on. We're going to take the cups off. So if somebody was really tender, if it was like a new injury, or some people are just super sensitive, I would again just put the cups stationary and just leave it at that. So I think that like about wraps us up. Does anybody have any questions at all? Just a sec. You're good. Yeah, it is unreal and it feels so good. Some people don't like it and I don't get it because it feels so damn good. So anybody with any questions? And again, I think I saw a question pop up there about For wet cupping, okay, so for those of you who don't know what wet cupping is, that is where you get a lot of blood from a lancet. I know it's very common in Eastern Indian cultures. I get a lot of people asking me for it. I'm not really equipped to deal with that much blood. I mean, normally you're taking out you're filling like a cup like this much full of blood in the wet cupping that I've seen done and that I've done myself. So, I mean, I'll do the little diabetic lancets, which a little bit of blood comes out, and then I'm changing the cups, but nothing that's significant. See you later, Jesse. Thank you. So yeah, wet cupping. Oh my gosh. Sorry, guys. So, yeah, wet cupping is great. Really good for sharp stabbing pain, all that kind of stuff. But I don't really use that too much in my clinic at all. So, any other questions before we sign off for today? If anybody needs to get a hold of me, you can just send me a direct message. My professional Facebook page should be linked to this page. It's Adrienne Coombs, DIP Dr. TCM, or you can just find me on Facebook, Adrienne Coombs, and direct message me there. For those in the States or actually anywhere in the world, basically, I am part of a huge network on Facebook of about 20,000 other acupuncturists all over the world. So if you guys are looking for somebody specific, please let me know. I'll try really my hardest to find somebody and link you up with somebody in your area. I don't do too many consults over the phone just because in Chinese medicine, it's so much about the person in front of you and being able to see and touch that person as far as diagnosis goes. So always better to kind of find somebody in your area. But if anybody has any questions at all, please feel free to message me. And yeah. So next week, like I said, I didn't get to talk about gua sha today because it's just a whole nother video in itself. So next week we're going to be talking about gua sha. So gua sha is a scraping method that is used in Chinese medicine. It's another myofascial technique, and it does so many amazing things just from scraping the surface of the skin. So we'll be talking about next week. Where am I located? I'm in Kelowna, BC, Canada. So we're way up north. It's almost snowing here. So if anybody has any more questions, in the meantime, please like and share this page, and I will see you all next week. Thanks, guys. Take care.